One of the most difficult things that a patient faces is hearing that he or she has cancer. Unfortunately, about 70% of patients with cancer in India present at late stages, either stage 3 or stage 4, which makes treatment extremely difficult and therefore survival even more difficult. My name is Anil Rustgi. I'm a physician and a researcher with a focus in my practice on gastrointestinal cancers, and I serve as director of the Herbert Irving Comprehensive Cancer Center at Columbia University in New York City. One of the most common misconceptions individuals or patients have about cancer is that if they have no symptoms, that means they have no cancer. That's simply not true. People can have no symptoms and yet have cancer. People can have symptoms that are worrisome for cancer. Some, not all of these symptoms may be persistent cough, nausea, vomiting, pain in different sites of the body, diarrhea, blood in the stool, blood in the urine. So it's extremely important that if one has any of these symptoms or other types of symptoms, that one seeks medical attention. People often ask, when the diagnosis of cancer is made, what does it mean in terms of stages? Stage 1 means that the cancer, no matter where it is in the body, is confined to a local site. And typically surgery will remove the cancer and offer opportunity for long-standing cure. When the cancer progresses to stage 2, it means it's starting to invade into the tissue. And if the cancer is stage 3, it's now starting to spread through the body, through the bloodstream, or what's called the lymphatic stream. And stage 4 means the cancer is actually spread, often to the liver, the lung, the abdominal cavity, the bone. There are about 23 or 24 million new cases of cancer worldwide. Unfortunately, that's an underestimate because many countries don't have formal data on cancer incidence, how many cancer cases per year, cancer mortality, how many people die from cancer every year. But that number is still a huge number. What sets India apart in terms of cancer? There's no doubt that cancer cases are increasing, cancer-related deaths are increasing. Some of it is due to increasing population. Secondly, aging population. Third, lack of accessibility to cancer care, especially in rural population groups. Social stigma. There's a concern that if I'm diagnosed with cancer, especially from my reproductive organs or my digestive tract, then I really should not share that information with people. So in spite of our advances in so many aspects of modern society, there's still a social stigma associated with cancer. Lifestyle factors. Western diet that is more enriched with fat and carbohydrate is definitely a risk factor over chronic time for cancer. And indeed, environmental exposures, pollution, as well as dietary factors, cigarette smoking and alcohol. So if you combine all these factors, psychosocial, economic, as well as dietary, lifestyle, and environmental, these all play complex roles in increasing the number of cancer cases per year, regardless of age, regardless of geographic location. Now, what I've been saying leads to the next question naturally. Well, so what are the factors that are driving late diagnosis of cancer in India? It's very complicated, but I'll try to list some of them. One is social stigma, a concern that if reproductive organs are affected or digestive tract is affected, that this will somehow bring shame to oneself, friends, and family in the community. Second is access, which is limited in rural areas compared to urban areas. 3 is financial. Not everyone can afford the cost that's involved with cancer care, especially with the therapies that are very complicated and prolonged. Another aspect, unfortunately, is that the screening rates for cancer are lower in India compared to other developed countries throughout the world. I'll give you one example, that the percentage of women getting cervical cancer screening in India is less than 2%. And also hard to measure, but screening rates for breast cancer, colon cancer, prostate cancer, melanoma in the skin, oral cancer are likely lower in many parts of India. So when you take all these factors together in a very complicated way, they're leading to later and later diagnosis of cancer in India. Many people ask, why is the rate of gastrointestinal or digestive tract cancers increasing in India, especially in younger people? Let me first define for you what I mean by digestive tract or gastrointestinal tract. This is the esophagus or food pipe, which transmits food into the stomach that starts digestion, then in the small intestine, then in colon, and then everything is evacuated through the rectum. The gastrointestinal tract also includes the liver and the pancreas. So what are the factors that are conspiring, converging to increase the rate of these cancers, especially in younger people? One is unfortunately a pandemic, if you will, of obesity in India and throughout the world. And I would urge you to read about this. And there are many factors that are increasing the rate of obesity in India and throughout the world, mostly processed foods that are rich in fat and carbohydrate. Secondly, and perhaps consistent with that, going along with that obesity is a sedentary lifestyle and less exercise. Also, again, environmental exposures, dietary changes with increases in cigarette smoking and alcohol. It's been well established for decades that chronic alcohol use and chronic cigarette smoking increase the risk of cancer, especially gastrointestinal cancers, 2x, 4x, 8x, which is enormous. So it's really important to reduce, if not eliminate, those factors. And the final thing that you'll often hear about, or if not, or maybe even read about, is the microbiome. So our colon has trillions of bacteria. Throughout evolution, there's actually a friendly relationship between the bacteria in the colon and colon health. But with the changes in body weight and food, bad bacteria are outnumbering the good bacteria and causing local inflammation in the colon, and also indirectly affecting inflammation in the liver and other organs, and increasing the risk of type 2 diabetes, as well as what's called the metabolic syndrome. And so we think all of these factors then are contributing to the increase in gastrointestinal cancers, especially in younger individuals, even in their 30s and 40s. It's very important that one gets annual exam by one's physician, starting at early age in one's teens, but continue that throughout life, even if there are no symptoms. But there are alarm symptoms that require diagnostic measures from head to toe. So when one has symptoms, one seeks attention with diagnostic tests, procedures, imaging, blood tests. But the whole purpose of screening is to do measures before symptoms have occurred, to try to detect lesions that are at the precancerous stage that can be dealt with perhaps by surgery or other measures. I like to think of screening for the appropriate age in consultation with one's physicians from head to toe. In India, of course, one of the highest incidences of oral cancer in the world. So a good dental oral exam every year, very important. Just takes 1 minute by the dentist or by the physician. Breast cancer screening for women with mammography once a year, starting at the appropriate age. A good skin exam for melanoma. These can be small bluish dots or lesions that one may think are just normal. So a good skin exam from head to toe. Colonoscopy in many countries starts at the age of 45. Please discuss this with your physician when that should start. If it's normal, probably one does not need to repeat it for another 10 years. Unless there's a family history of colon cancer, then it needs to be individualized. Pap smears for cervical cancer screening should be done in women on an annual basis. Again, when to start, consult your physician. Prostate cancer screening should be done annually with an exam and possibly a blood test called PSA in men. Please consult your physician. So what you can see, there's about 7 or so cancers that require screening at certain points in time, but the key is to continue doing the screening on a regular basis. Are there measures that can be done to avoid some of these screening measures? We're not at that stage yet, but research is trying to find out if blood tests can be either add or be substitutional, but this remains at the research level. So if you get certain blood tests called liquid biopsies, do not conclude that this is a substitution for general clinical screening measures that are endorsed by professional societies and physicians, not only in India, but throughout the world. Most cancers in one's life are acquired with aging. So most cancers still occur above the age of 55, 65, or 75. And obviously, with our population living longer, that is a big risk factor. And superimposed upon that is everything I've mentioned in terms of dietary, lifestyle, environmental, excess, financial hurdles, and so forth. However, it's estimated about 5 to 10% of all cancers have some genetic or hereditary basis. What are the clues for that? Family history. By that I mean that there are cancers across more than one generation. Secondly, early onset cancer, cancer that's occurring in 30s or 40s. And thirdly, certain types of cancers that seem to go together, like breast and ovarian cancer, pancreatic and breast cancer, colon and other cancers. If one gets a family history, one should report that to one's physician, who can take a more detailed family history, and we can do what's called genetic testing through either saliva sample or a blood test, looking for changes in what are called genes, the building blocks of cells and tissues. Genes have spelling codes, and if there's an error in the spelling code, the genetic testing can detect that, and that can inform what kind of screening and surveillance measures one should do. It could even lead to preventive surgery depending upon the type of genetic testing abnormality. So I encourage you to get a detailed family history and discuss that with a physician, because that may trigger genetic testing, and view genetic testing as a preventive measure. Prevention, screening, and surveillance all lead to early detection of cancer or pre-cancer. For general information about health and healthcare, please stay connected with this channel.